Here, let me go and discuss few question and answer about maternal and newborn care. In this PowerPoint, basically we're going together select all that apply type of question. This NCLEX practice questions. The first question here, a pregnant client, 32 weeks gestation, and that has mild preeclampsia, and she discharged to the home with instruction to remain on bed rest. She should also be instructed to call her physician if she experiences which sign symptom. Select all that apply. So it is the complication of pregnancies, eclampsia, preeclampsia, or pregnancy-induced hypertension. So this said headache, increase the urine output, blur of vision, difficulty of sleeping, epigastric pain, and severe nausea and vomiting. The correct answer is headache, blur of vision, epigastric pain, and severe nausea and vomiting. The rationale, they said headache, blur of vision means visual disturbance, epigastric pain or severe nausea and vomiting can indicate ocean maternal disease. Decrease and not increase the urine output is a concern because it could indicate renal impairment. Difficulties of sleeping, a common complaint during third trimester, is only a concern if the caused by any of other symptoms. So what next? Next question here, a nurse is palpating the uterus of a client who is 20 weeks pregnant to measure the fundal height. Identify the area on the abdomen where the nurse should expect to feel the uterus. So the pregnant uterus 20 weeks. So where should be the fundus? In pubis symphysis? Is it in between umbilicus and pubis symphysis? Is it just close to the umbilicus? Is it different process? What are the correct answer? It should be at 20 weeks. It should approximately umbilicus. So at 20 weeks, the fundus height should be at approximately umbilicus. Fundal height should be measured from symphysis pubis to the top of the uterus. Serial measurement assessment fetal growth over the course of pregnancy between the weeks 18 and 34. The centimeter measure correlated approximately with the week of gestation. Next, a client who is 15 weeks pregnant and come to the clinic for amniocentesis. The nurse knows that this test can be used to identify which characteristics or problem. Select all. So amniocentesis is a diagnostic procedure for high risk monitoring. Usually, amniocentesis performed after 14 weeks to rule out any congenital abnormalities. So number one, fetal lungs maturities, gestational diabetic, chromosomal defect, neural tube defect, polyhydramnions, and sex of the uterus. The correct answer is chromosomal defect, neural tube defect, and sex of the uterus. As I told you, amniocentesis we do for high risk monitoring to rule out the congenital abnormalities. Chromosomal defect like Down syndrome, it is congenital abnormalities. Neural tube defect is a congenital abnormalities. Determine the sex of the uterus. It is not a congenital defect, but we also can do this by amniocentesis. Sex of the fetus we determine by ultrasound, so we do not need amniocentesis because amniocentesis has some side effect. So rational they said in early pregnancy, amniocentesis can identify chromosomal defect and neural tube defect. It can also be used to determine the sex of the fetus. Amniocentesis can be used to evaluate the fetal lung maturities only during the last trimester of pregnancy. A blood test performed between 24 and 28 weeks gestation to use to evaluate the gestational diabetes. Ultrasound is used to identify polyhydramnions. What is polyhydramnions? Excessive amount of amniotic fluid. Amniocentesis can be used to treat polyhydramnions by moving excessive fluids. What next question? A nurse is teaching a course on anatomy and physiology of reproduction. In this picture, the female reproductive organ identify the area where fertilization occurs. So this is in this picture, we can see the ovary and ovary secret ova. And when the sperm is mobile, it is mobile from vagina to the cervix, then uterus, and then it is moving on towards the fallopian tube. Because fallopian tube is the part where the ova and sperm united and form the zygote. It is called fertilization. The fallopian tube have few parts, but which area particularly fertilization takes place? The correct answer is this one, right? So this area is called fimbria. This is ampulla, right? So after ejaculation, the sperm travel by flagella, move through the fluids of the cervical mucosa into the fallopian tube. This is the fallopian tube to meet the ova at the ampulla. So ampulla is a part of fallopian tube where sperm and ova united and formation zygote we call fertilization. Next question. A nurse is performing a prenatal assessment on a client who is 32 weeks pregnant. She performed Leopold maneuver and determined that the fetus is in the cephalic position. To identify where the nurse should place the dropper to auscultate fetal heart tone. So Leopold maneuver, by which we can find out the presentation of the baby, the lie of the baby, right? So the fetus is cephalic position. Examiner already told you. So in this area where you have to put the stethoscope to get the fetal heart sound, is it below umbilicus or above the umbilicus? Is it in different process? What is the correct answer? Basically, we have to put the Doppler ultrasound in between pubis symphysis and umbilicus. In this picture, we can see head down position, which is called normal presentation. And here we can see the bisque presentation. By Leopold maneuver, we can feel the baby's head or buttock and find out, is it cephalic, is it bisque, or others. Rational, when the fetus is in cephalic position, means head down. Picture number 1. Fetus heart tone are best ausculted midway between symphysis pubis and umbilicus. This area is called symphysis pubis, and this is the umbilicus. When the fetus is in this presentation like this, fetal heart tone are best heard at above the level of umbilicus. Next question. A nurse is monitored a client who is receiving oxytocin or pitone to induce the labor. The nurse should prepare which of the maternal adverse reaction. Select all category question. So common medication we used in maternity is a oxytocin. Other name is called pitone. Pitone we use for labor induction or postpartum to manage the postpartum hemorrhage. But pitone have some side effect. It is very important to know. Like they said, hypertension, jaundice, dehydration, fluid overload, uterine tetani means contraction, and bradycardia. So most common side effect, patient develop hyponatremia or painful contraction or hypertonicity. What is the correct answer? Hypertension, jaundice, dehydration, fluid overload, uterine tetani, bradycardia. Correct answer is 145, means hypertension, fluid overload, and uterine tetanus. Bradycardia, no, it can cause tachycardia. Rational adverse reaction to oxytocin in the mother include hypertension, fluid overload, and uterine tetany. The antidiuretic effect of oxytocin increase the renal reabsorption of water, leading to fluid overload or dehydration. Jaundice and bradycardia are adverse reactions that may occur in the neonate. Tachycardia, not bradycardia, is reported as a maternal adverse reaction. Sometimes NCLEX board asks a question, what medical condition we could discontinue the oxytocin or pitone? When we sustain uterine contraction or fetal deceleration or decrease the uterine output, we always discontinue the piton. Next question here. A nurse observed severe interaction between a client and her neonate son. Which behavior of the client provide evidence of mother neonate attachment? Select all that apply. Number one, talks and cools to her son, or cuddling her son close to mother. Do not make eye contact with her son. Request that the nurse talk to the neonate to the nursery, encouraging father to hold the neonate and take a snap when neonate is sleeping. Correct answer is talks and goes to her son and also cuddling her son close to her. So rational say talk, talking, cooling, cording with her son are positive sign that the client is adapting to her new role as a mother. Avoiding eye contact is a non-bonding behavior. Eye contact, touching, or speaking help establish the attachment with a neonate. Feeding a neonate is an important role of a new mother and facilitate attachment. The mother encouraging the father to hold the neonate may facilitate attachment between the neonate and his father. But this action does not necessarily provide evidence of mother neonate attachment. Resting while the neonate is sleeping will conserve needed energy and allow the mother to be alert and aware when her neonate is awake. However, it is not evidence of bonding. Next question here. A nurse is instruct a client about the breastfeeding. Which instruction should she include to help prevent the client from developing mastitis? Mastitis means inflammation of the nipple. It is common when mother give the breastfeed to the baby, right? So now go next. Washing the nipple with soap and water. Change the breast pad frequently. Expose the nipple to air for parts of each day. Wash the hands before handling the breast and breastfeeding, and make sure that the neonate grabs the nipple only and release the neonate grabs and nipple before removing him from the breast. The correct answer is change the breast pad frequently, expose the nipple to the air for part of each day, washing the hand before handling the breast and breastfeeding. Also, release the neonate grabs on the nipple before moving him from the breast. The rationale, because the mastitis is an infection frequently associated with the breaks in the skin surface of the nipple. Measure to prevent the crackles or fissure nipple help the prevent the mastitis. Changing breast pad frequently and exposing the nipple to the air for part of the day help to keep the nipples dry and prevent the irritation or infection. Washing hands before handling the breast reduce the chance of accidentally introducing organism into the breast. Releasing the neonate grabs on the nipple before moving him from the breast also reduce the chance of irritation. Nipples should be washed with water only. So tends to remove the natural oil and increase the chance of crackings. The new net should grasp the nipple and areola. Next question here. A client who is 37 weeks pregnant and comes to the office for prenatal visit. The nurse perform